Hey guys, today I'm talking with Dr. Erez all about the importance of brain health and what you can do to reduce your risk of neurodegenerative diseases like Alzheimer's and other forms of dementia. And stick around to the end of the video where I'll also ask Dr. Erez about breakthrough blood testing that makes detecting Alzheimer's simpler than ever. And by the way, if you have any questions, please feel free to leave them in the comments. I'll make sure Dr. Erez answers them. Dr. E, will you please just set the table for us and tell us why it is important to care about our brain health, especially since Alzheimer's is known as a disease of old age?
Good question. These diseases usually start 15 to 20 years before you actually show obvious symptoms. So the brain changes start early. You can see evidence of tau. You can see evidence of amyloid deposition. You can see small changes in cognition and memory that might be a little bit like imperceptible, or they might be more subjective. But yeah, the beginnings of this disease definitely start 20 or so plus years before, you're going to get a diagnosis.
Wow, so you're saying there are things we can do early on in life that will help to protect us from neurodegeneration.
Yeah, and so that's one of the benefits of having these blood tests available that allow us to get ideas of whether or not this is a problem for us early on, because we can start intervening, with lifestyle to try to decrease that pro-inflammatory state and the progression to cognitive decline and memory issues.
Then what would you say people should do early on in life, maybe in their 20s or 30s, to protect themselves from these types of diseases?
If you have some family risk, let's say, mother, father, grandmother, something like that, has dealt with Alzheimer's, then, focusing on diet, lifestyle, exercise, certain supplements and nutrients is going to be helpful. There's a lot of evidence that all of these things can slow down the progression and even prevent it from showing up in the first place. So, it's definitely one of these things that is pretty clear. I'll just give you a personal example because this came to mind. But I have on my mother's side, my grandmother has a twin sister, and one twin sister was much more sedentary, didn't really take care of her health, had a poorer diet, and she developed Alzheimer's quite a bit earlier than my grandmother. So it was almost a 15-year difference, which is kind of crazy if you think about it. And that was just diet and maybe some exercise. It wasn't like a targeted approach throughout lifestyle to try to prevent the issue.
Yeah, that is wild. That's like the perfect research study right there.
It is. Obviously, it's N of one, but it was pretty clear that one sister was was paying more attention to her lifestyle, and then the other sister wasn't.
Yeah, so family history then is one of the most important things to go into or factor into calculating risk, right? But aside from that, it's also the lifestyle and the diet.
100%. Yeah. And there's definitely a huge component of the lifestyle and diet. And genetics does play a role too. I'm not going to, and we'll talk a little bit about that, I think, talk about ApoE and what that means for your, tendency to get Alzheimer's.
Yeah, so we'll definitely dive into those different biomarkers as well. But I want to stick on the family history and the risk factors involved in that. So me personally, my grandfather actually, he had Alzheimer's too. So if you have a grandparent that developed Alzheimer's, how much more likely are you to develop the disease? I know that, like you said, diet and lifestyle factor in, but what is just in general the increased risk of having a family member have the disease?
It depends on which family member you're talking about, but it is a significant increased risk. It's much less than, let's say, having like an ApoE4 variant, but certainly like a primary family member is going to bump up your your risk of having the disease.
So you highlighted a really important part, though, is that just the like knowing that you had, maybe a grandparent have the disease, it's much more helpful to actually do the genetic testing to see if you have those genes.
Yeah, absolutely. So that would cue me in much more to like be like, hey, let's go ahead and get an ApoE genetic test to see, if you've got the variant that is protective. There's actually a variant that is protective. So if you have this variant, you're less likely to get Alzheimer's. There's a variant that's kind of like the standard that most people have. And then there's a variant that is actually increases your risk tremendously. So, ApoE2 is the variant that's protective. ApoE3 is kind of the baseline variant. And then ApoE4 is the one that increases your risk significantly. So if you have two copies, one from your mother, one from your father, then you're 12 to 16 times, more likely to get Alzheimer's. And if you have one variant, it's less, but it's still way above baseline compared to if you just have two copies of the ApoE3.
I think it'd be scary to get the testing done, honestly. I mean, I know we're talking about how you can reduce your risk, but it must be frightening for people to get that testing to then see whether or not they have these genes.
Yeah, and that is like a conversation a lot of times we do have. And I think part of the fear is that maybe somebody's seen somebody go through Alzheimer's and, and there's, the neurologist says, well, there's nothing that we can do, or there's no treatments that are really going to move the needle. And I think that's where some of the fear comes in, is like, well, I don't want to know. Why would I want to know that I have this increased risk? I just want to kind of live my life. But in reality, now that we're starting to figure out that there are things that can be done to really prevent this if started early enough, in combination, not one thing is going to fully decrease your risk, then it becomes much more important to know that information, because you can start before the 20 years before which the changes start to develop in your brain. So it really, really is useful to know. And there may be some people that just don't want to know, but I'm certainly in the camp that I would want to know that information.
Yeah, I love that. That's such an important message. If people know that there's something they can do about it, then they're much more likely to probably want to get the testing done, instead of thinking that their fate is determined and why would I want to know if I'm just going to develop this anyways.
100%. Yes.
So go into a little bit about lifestyle factors and the different dietary choices that you can take to protect your brain.
In terms of diet, there's several categories that I would break things down into. One is really lowering your intake of sugar and carbs and keeping your blood sugar nice and even, and so that you don't develop something called insulin resistance. And there's a lot of people that talk about, Alzheimer's being a disease of insulin resistance in the brain. So, keeping your simple carbs low, meaning, sugars and fructose and anything that gives you that jump in blood sugar low is going to be really important. And so kind of a lowish carb diet when you're not spiking your blood sugar. The second piece of it is a phytonutrient rich diet. So that means it doesn't have to be vegan or all the way in one camp or another, but it needs to be phytonutrient dense, meaning it's got to have those blues, reds, yellows, all the nutrient dense and phytochemicals in plants are really important. So in particular, I'll just highlight one, and those are anthocyanins. And those are in the purple food groups. So blueberries, black currants, purple potatoes, plums, all of these things have that pigment in there, and they have the that antioxidant that has been shown to really decrease the damage in the brain from some of these disorders. So yeah, that would be another really up there piece of it. Another thing is trying to get a Mediterranean type diet. So I generally recommend a Mediterranean diet where, high in fish. So in particular, fish are, you're going to have omega-3s in them, and EPA and DHA, which are like components of that are anti-inflammatory and probably protective. Another thing is occasionally getting into something called ketosis, which is when you're burning fats for fuel instead of sugar. And so you can do this through fasting. You can do this through a low carb approach. It doesn't have to be all the way in like ketosis, but occasionally fasting or shortening the eating window, let's say to 8 hours or 6 hours during the day, can help get you into that ketotic state and is probably beneficial for Alzheimer's disease and preventing the disease from coming on.
A lot to unpack there, but super insightful stuff. So just to summarize, number one is low insulin levels. So eating less sugary food so that your blood sugar is stable. Number two would be more plants, particularly the purple kind with anthocyanins. And then number three would be occasionally getting into ketosis so that you're not always using sugar for fuel.
Yeah, absolutely. And there's a couple other categories that I would definitely throw in there, but those are just three that are, I like to talk about. So,
yeah. And you also mentioned, right, the omega-3s and protecting your brain through healthy fats too. So I want to make sure that I, mention that as well in the summary. Cool. So let's talk about the blood testing, right? So now there's less invasive tests, right?
So there used to be, the gold standard used to be like a PET scan, amyloid PET scan, or tau PET scan, which is an imaging, involves radiation. It's thousands of dollars, or a spinal tap where they look at your cerebral spinal fluid and they look for certain proteins and amyloid and things like this. And both of those are not fun procedures and they're costly. Spinal taps, there can be side effects. And now in the last few years, it used to be maybe 4 years ago that these things were available only in research labs, and just people who are involved with like research studies were getting access to this. And then in the last year or so, things have really ramped up where even the kind of standard labs have access to this. So LabCorp, Quest, they have access to these like more definitive tests that you can just look in your blood and see, hey, are you going to be at risk? Which opens up the doorway to say that we can start getting screened when we're 20. Or certainly like 20 years before we would expect the disease to sort of show signs. So it's really cool stuff.
Wow, that is super cool. So you can just go to your local Quest and get that added into your blood testing, right?
Yep. And more of these tests are available, and hopefully the price will come down. For people that have symptoms, they're usually covered by insurance. For people who want to prevent this sort of thing, slightly different story, but there are ways to get it outside of insurance.
Wow, that's fantastic. So what would you say someone should do then? Should they just talk with their doctor about this, ask about these tests, and see if they can get them done?
Yeah, absolutely. And you may need to do some education on your part, because not every physician is going to know about this. Even, let's just say, neurologists, they might have only started offering this stuff within the last 6 months or the last year, or may not even know about some of these blood tests. It's possible. So, yeah, you may need to, go out on a limb and say, hey, can you look into this or something like that?
Yeah, educate yourself, learn about it, have something ready to hand to your doctor or talk to him about, so it's written down so you don't forget. Can you tell me, if say you're 40 years old and you get the blood testing done and you show signs of Alzheimer's, what happens then?
Well, that's when you start digging in and you start trying to track this over time. So maybe there's some inkling that there's a small, maybe you're slightly close to the upper range of normal. And at that point, you're like, you know what? I also have a family history. Then we need to track this over time. And that's when you start doing additional tests to sort of see, okay, well, is there inflammation in the brain? What's the insulin like? What's my cholesterol like? What are my nutrient levels like? What are my hormones like? What is my homocysteine? So we spread out and we start looking in more depth, trying to figure out, okay, what are some of the causes that are like pushing us in that direction, where there's more tau or there's more inflammation in the brain.
Yeah, and so essentially you're looking to modify, or you're trying to optimize all those modifiable risk factors.
Absolutely, because there is a lot that you can modify, and that's where you can hit it from multiple angles: lifestyle, diet, exercise, supplements, brain training, learning new skills. Dancing is fantastic for that. Word puzzles, adding certain hormones if you're deficient, adding certain nutrients, B12, folic acid if you've got a high homocysteine, wearing a Dexcom glucose monitor if you've got blood sugar issues. So yeah, I'm looking for certain toxins that some people are exposed to, like mercury. If you've got a high level of one of those toxins, figure out where it's coming from and eliminate it from your, stop being exposed to it. So if it's lead in the water, or if it's mercury in tuna fish that you're eating, or swordfish or something like that, then yeah, we can work on decreasing that.
Do you want to go into what some of these new biomarkers are quickly?
Absolutely. I'd love to dive into this and just tell you kind of like the core biomarkers that I would get in somebody that came to me that was maybe worried about their memory and maybe had a family history of Alzheimer's. And I'll start off with some more basic ones, and then we'll work our way to like the more new and unique biomarkers. So the first one I'm going to talk about is insulin and your blood sugar. So insulin is a great marker of how much insulin resistance is going on, and which we already talked about in detail. So I usually will get fasted insulin and a hemoglobin A1C, which gives us like a 3-month measurement of your blood sugar. And it can tell us if you're pre-diabetic, or maybe you're all the way diabetic, or maybe you're just inching towards that insulin resistance piece.
What about number 2? What else would you look at?
So homocysteine is another marker I would definitely get in somebody like this. So elevated levels are associated with stroke. They're associated with damage to the endothelial lining of the small blood vessels in the brain. They're higher in patients with Alzheimer's and correlated with worse progression. They're linked to brain atrophy and cognitive decline. And we can do something about it. It's pretty easy to lower somebody's homocysteine with certain nutrients and vitamins. So super important to look at that because it's so modifiable.
Yeah, I see a theme here too. You're starting out with the modifiable risk factors, the easier, sort of the low-hanging fruit of what you can do, right?
Yeah.
Okay, awesome. What's the third one?
So the third one we kind of already talked about, and that's ApoE, getting your ApoE genotype. And this is really important to do. First of all, it tells you, if you're how much of an increased risk you're at, but it also modifies how we decide what treatments to give you. Having that ApoE4 seems to impair amyloid clearance. It affects lipid metabolism and neuroinflammation. So if you have that E4, or you have one of those, then yeah, there's a lot that we can do, but knowing that gives us more power to make changes in your lifestyle.
Are those the more common ones, or the other more common ones? Or do you have maybe some of the ones that most people don't know about and their newer biomarkers next?
Yeah. Let's talk about the ones that are a little bit more targeted towards Alzheimer's and the newer ones that have come out recently. So tau 217, this is phosphorylated tau. It is a really strong predictor of Alzheimer's. So it's when the levels are elevated, it's correlated with tau tangle accumulation, and that is very specific for Alzheimer's pathology in particular. Whereas, some of the, just because you have amyloid deposits in the brain, there's people that have tons of amyloid, but they don't have the Alzheimer's disease. And so tau is even more specific. It came out in the last year or two where it's more available. And yeah, it's a really, really powerful test.
Got it. Important indicator right there, tau. Is that all? Any others?
Yeah, I mean, we could talk about amyloid beta 42 to 40 ratio, and having a low ratio indicates that there's amyloid plaque deposition. And having amyloid plaque deposition does raise your risk of developing Alzheimer's. And so this is looking at kind of a hallmark of Alzheimer's. But, you always want to take the amyloid and interpret it with the tau markers so that you get a better idea of what's going on.
Right. Because like you said, you can have amyloid plaques, but that doesn't necessarily mean you have Alzheimer's. But if you have the amyloid plaques and the tau tangles, then you're more likely.
And the amyloid beta ratio is a little bit more indicative of the Alzheimer's piece because it's a certain type of amyloid deposition. But yeah, definitely something you want to take into consideration with other testing.
Understood. Awesome. Any other biomarkers you want to touch on before we go?
Yeah, there's two other ones I think are at least worth mentioning. One of them is called glial fibrillary acidic protein, and it is a pretty useful test. It looks actually at the neuroinflammation levels. There are certain cells in the brain called astroglia, and they can cause a lot of havoc and cause a lot of neuroinflammation. And this is a great marker of that. And it can be elevated from other causes, but it gives us something to target. And there's lots of things that we can target for neuroinflammation, things like curcumin, omegas. There's a certain eating an anti-inflammatory diet. So all of those things, you can start those early and start decreasing that glial fibrillary acidic protein. And another piece of that is that it rises early in Alzheimer's continuum. So it might even rise, you might see it elevated even before, let's say, tau or, some of the other markers. Fascinating.
So that's one of those that will be an early indicator. You want to look at that one early on.
Yeah. And there's one more. It's called neurofilament light chain, and it's a general marker of axonal damage and degeneration. It's not as specific, but it tells us that there's damage in particular to the axons, which are the little connections basically that are in the brain. And it's elevated in lots of different conditions. But if we see this being elevated in combination with other markers of Alzheimer's, then we've got another thing to try to target. And detecting this neuronal damage early gives us a lot of power to make changes and interventions.
Sweet. Well, it's a lot to digest. It's very promising, and I'm optimistic to know that there are things we can do to reduce and prevent these neurodegenerative diseases like Alzheimer's. And I would just ask you, what would you say to someone who wants to learn more about this, or they want to get some of the testing done? Would you say just speak with their doctor?
Definitely ask your doctor about this stuff, especially if you have a family history or you already know your ApoE status, for example, and you're ApoE positive. Certainly if you have memory issues or you're starting to notice as you age that you're having some issues, then definitely bring this up. But I would encourage you to get this early on, 20 years before the disease presents itself, certainly. So for most of my patients, I say try to get this when you're 40, if you have that family history especially. So yeah, talk to your doctor. Not every doctor is going to know about every single one of these blood tests. A functional medicine doctor obviously is probably going to be a little bit more aware. Even neurologists haven't started using these tests up until the last, year or two. So yeah, you may need to do some education on their part or, talk to them about what you're wanting.
All right. Well, if you're 40 or older, you know what to do. If you're not yet 40, set your calendar, set a reminder to talk to your doctor about this and get the early testing. But as always, thank you for your time, Dr. Erez, and thank you guys for watching.
Great to be here.